I'm Jodi Feinberg, and I'm a senior in the School of Nursing. My project is called Home Heart Health, and the idea is to implement cardiac rehabilitation into the home care setting. Right now, patients receive rehabilitation in the inpatient and sometimes in the outpatient setting, but there's a gap in care when they go home and they're not receiving cardiac specialized care. Ultimately, these patients are deconditioning or being readmitted back to the hospital.
What happens all too often is that people get discharged from the hospital with heart disease, and the next week they find themselves back in the hospital. Jodi is helping these people live independently.
When I received the email about the President's Engagement Prize, I instantly forwarded to Jodi, and I said to Jodi, this has your name all over it.
Terri Lipman, my mentor, is my inspiration. She is an incredible role model. With her support and with the support of my family, I realized that this was a goal that I could achieve. Integral to the success of my project is my partnership with NYU Langone Medical Center and the Visiting Nurse Service of New York. Together, we will develop a model for cardiac rehabilitation in the home. I'm so excited to be collaborating with the Visiting Nurse Service of New York. I think this is an incredible opportunity, and I'm very fortunate to have their support.
Jodi has a patient-driven model. She will be interviewing patients to learn about their experience, integrating patients in the planning and evaluation of the program, and educating home care clinicians to deliver her project.
I plan to collaborate with cardiac patients and their families in order to receive their input and their feedback so the model can be best for the patients.
With the Affordable Care Act, nurses and healthcare providers have to learn how to care for patients outside of the walls of the hospital and understand their lived experiences at home. And that's why this is so important, because this program is focused on patients at home. Jodi's goal is to impact the care of cardiac patients in New York, but the impact can be much greater. When she disseminates her project, it can be adopted nationally and impact the care of cardiac patients across the nation. I believe that Jodi will be a true leader in the nursing profession.
Jodi's going out in the world and being a proud representative of Penn Nursing in the world and doing so much good as a consequence.
I'm so excited. This is a dream come true, to be supported by the University of Pennsylvania to create an innovative project that can make a difference on a larger scale. This is more than I could have imagined my career being when I first graduated, and I'm starting the next chapter of my life.